Natural and home remedies for histrionic personality disorder. Histrionic personality disorder, HPD, is part of a larger group of psychological disorders, called Cluster B personality disorders. Disorders in this category are generally categorized as being dramatic, emotional, or erratic. People with HPD have a distorted mental image of themselves. They often base their self-esteem on the approval of others. This creates a need to be noticed. Because of this, people with HPD may resort to dramatic antics. Hysteria, also known as hysterical neurosis, is a psychological state that is caused by extreme emotions such as overwhelming fear or sorrow. The psychological strain will become so severe that the individual will begin showing physical symptoms. The person will be extremely emotional and will often feel pain associated with supposed problems. For centuries, it was thought that hysteria only affected women. In fact, the word hysteria comes from the Greek word hystra, meaning uterus, because it was thought that all hysterical symptoms stemmed from the female uterus. Women are diagnosed with HPD more often than men. That may be because men report their symptoms less often than women. HPD is not a devastating psychological disorder. Most people with HPD function successfully in society and at work. In fact, people with HPD usually have great people skills. Unfortunately, they often use these skills to manipulate others. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, people with histrionic personality disorder have at least 5, or more, of the following symptoms. Is uncomfortable in situations in which they are not the center of attention. Has interactions with others characterized by inappropriate sexually seductive or provocative behavior. Displays rapidly shifting and shallow expression of emotions. Consistently uses their physical attention to draw attention to self. If you have HPD, you might also be easily frustrated or bored with routines, make rash decisions before thinking, or threaten to commit suicide in order to get attention. The exact cause of histrionic personality disorder is unknown. Scientists believe it is an outcome of both environmental and genetic factors. Some families have a history of HPD, which lends credit to the theory that the condition may be explained in part by genetics. On the other hand, children of parents with HPD may simply exhibit behavior they learned from their parents. It is also possible that a lack of discipline or positive reinforcement of dramatic behaviors in childhood can cause HPD. A child may learn HPD behaviors as a way to get attention from their parents. No matter the cause, HPD usually presents itself by early adulthood. There is no specific test that is used to diagnose HPD. If you are troubled by your symptoms and seek medical care, your primary care provider will likely begin by taking a complete medical history. They may perform a physical exam to rule out any physical problems that might be causing your symptoms. If your primary care provider doesn't find a physical cause for your symptoms, they may refer you to a psychiatrist. Psychiatrists are specifically trained to recognize and treat psychological disorders. A psychiatrist will be able to use expert questions to get a clear view of the history of your behavior. An accurate assessment of your behaviors will help your primary care provider diagnose you. However, most people with this condition do not believe they need therapy or help, making diagnosis difficult. Many people who have HPD receive a diagnosis after they go into therapy for depression or anxiety, usually following a failed relationship or other personal conflicts. Hysteria is not a physical disease that can be treated and ultimately cured. It is a serious psychological disorder. As with many mental problems, a person can be born with it. It can also be brought on by emotional or traumatic experiences such as witnessing a crime or the unexpected death of a loved one. Hysteria can also develop in children who have lived in an extremely abusive environment. Unfortunately, hysteria can also be a side effect of chemical drugs. Long-term use of the anti-anxiety drug Valium, for example, has been proven to cause the symptoms of hysteria. A person with this disorder might also be uncomfortable unless he or she is the center of attention. Dress provocatively and/or exhibit inappropriately seductive or flirtatious behavior. Shift emotions rapidly. Act very dramatically, as though performing before an audience, with exaggerated emotions and expressions, yet appears to lack sincerity. Be overly concerned with physical appearance. Constantly seek reassurance or approval. Be gullible and easily influenced by others. Be excessively sensitive to criticism or disapproval. Have a low tolerance for frustration and be easily bored by routine, often beginning projects without finishing them or skipping from one event to another. Not think before acting. Make rash decisions. Be self-centered and rarely show concern for others. Have difficulty maintaining relationships, often seeming fake or shallow in their dealings with others. Threaten or attempt suicide to get attention.